Treatments of multiple myeloma have really changed over the recent years. Bortezomib is a proteasome inhibitor that has been an integral part of most of the treatment regimens we use for treating multiple myeloma. Now, the bortezomib has been combined with another drug called Revlimid or lenalidomide, and that combination is probably one of the most effective regimens that we use for treating newly diagnosed multiple myeloma today. The problem with bortezomib is it is a drug that has to be given either subcutaneously or intravenously, so the patients have to come to the clinic at least once a week. The Ixazomib is a proteasome inhibitor, so it's the same class of drugs but has been formulated differently, and the molecule is different enough that it can be taken by mouth instead of having to be given intravenously or subcutaneously. So this clearly is a great benefit to the patient, as they don't have to come to the clinic every week. The other advantage of this oral proteasome inhibitor, Ixazomib, is that it does not cause peripheral neuropathy as a major side effect like bortezomib. So that clearly has implications in terms of how long patients can stay on treatment. So this clinical trial utilized Ixazomib in combination with lenalidomide and dexamethasone, essentially replacing the bortezomib from the prior regimen, thus coming up with a regimen that's completely oral, so patients come back just once a month to see the physician, and also that seems to have less of side effect, especially the peripheral neuropathy that we saw with bortezomib. So this trial had the phase 1 and the phase 2 component. The phase 1 component essentially allowed us to determine what would be a safe dose of Ixazomib that we can combine in the regimen. And the phase 2 study kind of gave us a taste of what the efficacy of this regimen would be. And based on the results, it seems like it's comparable to what we would have expected from a bortezomib combination. So clearly the next step is to prove that it is indeed better than just lenalidomide and dexamethasone in a group of patients with newly diagnosed multiple myeloma. So that phase 3 trial is currently ongoing.